Hi, I'm Dr. Kolakowski. I'm a vascular surgeon here at Choice Medical Group, and I'm here today to talk to you about varicose veins. It's one of the most common disease processes that I see in my office today. More than 40 million Americans are diagnosed with varicose veins or venous disease in the United States on a yearly basis. The common symptoms that I will see in patients who have venous disease will be aching in the legs, cramps specifically at nighttime, skin changes such as rashes, redness, or ulcerations. If we are seeing those problems, as well as edema, swelling of the legs, then they are recommended that they follow up with a vascular specialist. Patients most at risk for venous disease are females. Number one, females who've had multiple pregnancies, obese patients, patients who have had jobs or scenarios where they're standing or sitting for long periods of time during their lifetime, a family history of varicose veins or venous disease, as well as history of DVT. These patients are at higher risk for venous disease. When I see these patients in the office, the most common scenario will be I will get a non-invasive ultrasound of their legs to evaluate for the disease process. And the ultrasound itself is very important because it will basically give me a roadmap of what's going on regarding their veins and how we can go about treating it. There are multiple ways to treat varicose veins, and that starts out with conservative all the way to surgical options. Now, conservative may be to wear compression socks, and these are tight-fitted socks that we wear during the day, take off at nighttime, and they will make your legs feel better and decrease the amount of swelling. However, they don't typically cause the veins to go away, but they will stabilize them and prevent them from getting worse. However, if there's an underlying process going on with the veins when we do the ultrasound, then there are some procedural options for these veins, and that can start with injections, where we inject a solution into the vein to shut down the vein and have the body reabsorb it over time. The larger veins, if they are not functioning properly, we can do what's called an ablation procedure, where we either inject glue or burn the inside of the vein with a heat source to actually shut down that vein and prevent the vein from allowing blood to flow back down the leg. The final option is a surgical option, and that would include vein stripping, or what we call a microphlebectomy, where we make small incisions in the leg over top of these varicose veins and remove them. So, with this being said, varicose veins is a very common disorder that we're seeing these days. It is a treatable disease process and can improve your life significantly by minimally invasive options or just conservative management. So, thank you very much.